The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc. Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com.
Hi, my name is Dr. Megan Pesch. I am a developmental and behavioral pediatrician at the University of Michigan. I'm also the director of our congenital CMV developmental follow-up clinic. Welcome to this podcast episode, talking about CMV if you're pregnant, thinking about pregnancy, or have a new baby. This is part of a 6-episode podcast series. Let's talk about CMV. Today, I'm speaking with Amanda Devereaux. Amanda, can you tell us a little bit about yourself and your work with parents and parents-to-be?
Hi, Megan. Glad to be here. My name is Amanda Devereaux, and I'm a maternal child health nurse. That's where my focus has been in nursing for the last 8 years. And I'm also the program director for the National CMV Foundation. Through my work, we're trying to let people know about CMV. We're trying to catch people before they have a baby, when they're planning a baby, and let them know what they should be avoiding during that time. And we also work with people who are already parents or already have a child with congenital CMV.
That's really great. And, for our listeners, I should say that Amanda and I have known each other for a few years now through a lot of work and advocacy about CMV. So, Amanda, I appreciate you so much and what you've done for other families affected by congenital CMV. And, I think your work is especially important because a lot of people don't know about CMV in general. So it can be especially important for parents or people who are thinking about becoming parents. Just a reminder for all of us, anyone can get CMV at any age. It's an incredibly common virus, and many kids get it even before they're 5. Most adults do end up getting it before age 40. And so once someone gets CMV, the virus stays in their body, similar to the virus that causes chickenpox. And then, it can come back later in life and people can get shingles. So once somebody gets CMV, the virus can stay in their body and it can become reactivated over time. There are many different types of CMV infection. So there is a primary infection, and that's the first time someone catches CMV or a first CMV infection. So that's a primary infection. A reinfection is when someone gets infected again. So similar to like the flu with CMV, you can get infected with a different strain. So a reinfection. A reactivation is when an earlier CMV infection that's been lying dormant in the body becomes active again. And then lastly, and this is what we talk about a lot, is congenital CMV. And that's when a baby gets CMV before birth. So when it's passed through the placenta to the growing baby. Amanda, can you talk about congenital CMV a little bit?
Yeah, well, just like you said, Megan, when the person who's pregnant comes into contact with CMV or they have a reactivation or a reinfection, that virus can cross the placenta and get to the developing baby, just like you said. And so sometimes that causes problems. It can cause severe complication for babies. It can cause a stillbirth, a miscarriage, all the way down to where it's really causing no symptoms at all. So most babies are not going to have any symptoms at birth, but complications can happen months or years later, and they can be lifelong. And the risk of complications is really the greatest if the pregnant person has a primary CMV infection. So the first time that they've ever been exposed to this virus during the first 3 months of pregnancy, which is during the first trimester, and all the organs and brain and everything are developing during that time. So that's when we think it's really the most serious.
Right. And so babies that are affected in utero by CMV, who are born with congenital CMV, they can have, signs or complications ranging from, pretty severe brain anomalies. They can have seizures, cerebral palsy, intellectual disability, learning problems. all the way to, kids who perhaps have no complications at all, and then everything in between. And we also see hearing loss being something that's really common in congenital CMV, even among babies who are born looking perfectly healthy. Um, so, Amanda, what do you tell people about the spread of CMV?
So we tell them that when someone has an active CMV infection, they can spread the virus to somebody else. And so it really spreads pretty easily through body fluids. I mean, you've got to be close enough to somebody to, in most cases, to come in contact with their body fluids, like saliva, like urine, blood, semen, vaginal fluids, breast milk, things like that. And so really direct physical contact with those fluids is the main way that we're seeing people spread this. And I've heard it said many times before that toddlers are hot zones for CMV, the spread of CMV. So if we think about toddlers, they're potty training, or they're changing, they're wearing diapers. The pregnant person is changing a baby's diaper or a toddler's diaper. They're drooling all over everything, and so that's kind of maybe the highest risk for the spread of CMV is coming into contact with the urine and saliva of toddlers, but certainly CMV can spread in other body fluids besides urine and saliva. So one example I always like to give, because sometimes I get the feedback that, well, of course you should be avoiding the urine and saliva of other people. Of course you don't want to, share a cup or spoon with a toddler, but when you're busy and maybe you're pregnant and you're running around and your toddler is eating their breakfast and they only eat half of their muffin for breakfast, and you think to yourself, oh, that's good food, I shouldn't waste that. And so you just you eat the other half yourself. And really that's an example of something that you shouldn't be doing when you're pregnant or thinking about becoming pregnant, because that's just the perfect opportunity to get that little toddler's saliva into your body.
Totally. That's such a great example. And I think too, a lot of us who work professionally with children, I think our guards are really up when we're at work, especially nowadays, we're super good at hand washing and hand sanitizer and masks and all that. But when we get home, with our own kids, our guards can kind of get let down a little bit. And so, right, although everyone tries their best to wash hands after, changing diapers, sometimes you change a diaper and then your toddler's about to throw themselves down the stairs. So you have to chase after them and maybe don't, wash as well. Just, an example. And so I think, yeah, being really aware of all those maybe not so obvious situations where people can come in contact with kids' body fluids. So we always talk about kids under 5 or toddlers. Amanda, can you explain a little bit more why toddlers are kind of particularly at risk of catching and transmitting CMV?
Sure. Yeah. So like we've talked about, a lot of toddlers, well, a lot of kids are going to catch this before the age of 5. So the deal with these little guys is they're just swapping germs all the time. They're in daycare, they're drooling, they're sticking their finger in their nose, and then they're going over to their friend and they're sticking their finger in that friend's mouth, and they're sharing all sorts of toys. And these germs, when the kids are little like that and they just kind of do whatever they want, the germs tend to just spread easily. So this is something that spreads easily in daycares. So when we talk about groups who may be at a higher risk for catching CMV, we're talking about toddlers and young children who are sharing germs, and then we're talking about pregnant people who work with children in a daycare center, who have their own children under 5 who are going to daycare, possibly healthcare workers who are working with children. But like you've mentioned, healthcare workers tend to do a pretty decent job of using that PPE. And I think when we're, really comfortable with these little kiddos, you're right, sometimes we let that guard down. And it seems like that may happen more in a daycare setting or an in-home setting than like a hospital or clinical setting. So those are the groups that we kind of are, maybe using a little extra caution or advising to take a little extra precaution during the pregnancy.
Yeah, that's totally right. And I think, there have been some studies that have shown that if, you show up to a daycare and you test all the kids' saliva at any given point, more than half of them will be actively shedding CMV. We often talk about shedding the virus. And so shedding the virus just means that after someone has the infection, you can still find virus if you tested it in their saliva or urine or bodily fluids. So when we talk about shedding, it means that someone can still be contagious even after those symptoms are gone. And kids can shed the virus for months and months after they get that initial infection. So, and again, without any symptoms. So it's super hard to know who is shedding it, or actually, you can't know unless you test their saliva, which we would never do.
I think it's real important to know that all kids are at risk. You're not going to know who's shedding it and who's not. I mean, on a rare occasion where a child actually does get that diagnosis that they're shedding CMV, they're really not a greater risk than any other kid, because the next kid that walks in the door is very likely to be shedding it too. So we really got to treat all those young kiddos with the same level of caution when we're pregnant or planning a pregnancy.
Exactly. And there have been some studies that have shown that babies who are the second baby or third or fourth in the family are much more likely or at greater risk of being born with congenital CMV than the first, because that there's a sibling at home to kind of spread that the virus around. And then, like you said, also people who work with children, daycare workers or teachers are especially at risk. So important to know your risk and ask your doctor. It's important to know about prenatal exposure to CMV, which is before birth. If a baby is exposed to CMV after they're born, it's really such a different thing than when a baby is exposed in utero. When a baby is exposed in utero, that, like you said, Amanda, the virus can really alter the way some of their organs form or cause hearing loss. A postnatal exposure, say like if a baby was to drink breast milk that has CMV in it, for the most part, I mean, these babies do really well and there's no harmful effects of that. But, because a lot of babies are exposed after birth, even though we know that for the most part, unless the baby's in the NICU or quite sick, even though those babies don't get complications of the afterbirth exposure, it can be really tricky to test a baby for CMV, say after they're a few weeks old, and be able to figure out, okay, was this a congenital or prenatal infection or a postnatal infection? So, that's why we really like to have babies tested within the first 3 weeks. If they're tested later, again, we can't really tell if it was postnatal, which is usually no big deal, or prenatal or congenital, which can be very serious. In terms of testing right now, there really isn't a standard of care for testing babies for CMV at birth. So even though, we might have our own opinions, and I think, I personally think it's great to test as many babies as possible. People should really talk to their doctor about whether or not CMV testing might be appropriate, for their newborn baby. A lot of the times, or most of the time, babies born with congenital CMV just look perfect and are completely healthy appearing. So it's really tough to know if a baby has CMV just based on looking at them. That's why testing can be really important. So back to prevention. Amanda, CMV is so common. Preventing it is going to be about ways to help people lower their risk. Can you tell me a little bit about what you recommend people do to lower their risk?
Yeah, sure. So we really try and share 5 simple tips to reduce your risk, because you're right, we can never completely eliminate the risk. It's always there, but reducing that risk is really important. And so avoiding contact with saliva when kissing a child. So especially those little kids, kids under 5. Kiss them on the forehead, kiss them on the top of the head, give them a big hug when you're pregnant or thinking about a pregnancy, just avoiding that saliva. don't put a pacifier in your mouth. It's very tempting to pick up a pacifier that has fallen on the floor and put it in your mouth to clean it off and give it back to the kiddo. People do that, and that's okay, but that's something that people should really think twice about when they're pregnant or planning a pregnancy. As we've said before, don't share food. And then also, same thing with utensils, drinks, and straws, avoiding that saliva again. Don't share a toothbrush. And then wash your hands after changing diapers. And also, if you're handling like children's toys or toddler toys where they've been sticking the toys in their mouth and things like that too, that's a really good time to wash your hands also. Hand washing is very effective at stopping CMV. So that's what we're really just encouraging.
Those are all great tips, Amanda. And we've all been thinking a lot about viruses over the last couple of years with COVID. And I think it's important to point out it is a lot easier to get COVID than it is to get CMV. So if you kind of take those precautions and washing your hands, I think it can be really effective. But all these recommendations and just like thinking about CMV in general, I know it can be really overwhelming. And women have so much to think about when they're pregnant already. So, it is just one more thing, but it is, it can be these really important small changes that people can make. And most people will get CMV eventually. So having it or catching it, either if it's for the first time or a reinfection or even a reactivation, I mean, it is nobody's fault. I always say, like, all you can do is try, right? All you can do is your best. So I don't mean to point any fingers at anybody who catches CMV, because we all are probably going to get it at some point. So for adults who do have CMV, I think it's important to know that most won't even know it because they'll have no symptoms or very mild ones. Like some adults can get some fatigue or lymph nodes that are swollen or a sore throat, but most will have no symptoms and never even know that they have CMV.
You're right, Megan. Most people are not going to know that they have this virus. And a lot of times that's the feedback that we get from people who have delivered a baby with CMV is that they had no clue during the entire pregnancy that they were ill. And if they did have any symptoms, they were symptoms that it was easy enough to say, oh, of course I'm tired. I'm pregnant, of course, that's just part of the deal when you're pregnant. And so you're right. Most people are not going to know that they had this infection either when they're pregnant or not pregnant because the symptoms are so mild. And so I guess I would say we want people to feel really comfortable asking their doctor about it. So you're allowed to ask questions. Your doctors work for you. So if you're thinking about a pregnancy or you are pregnant, it's definitely your right to ask about CMV. This is something that is pretty common, and it's something that people deserve to know about so that they can make informed decisions during their pregnancy and when they're planning a pregnancy. And so definitely bring this up with your doctor and get your questions answered.
Yeah, I love that. It's all about, empowering yourself and asking those questions. And, I think we in the medical field are learning more and more about CMV every day. So asking your doctor, can be really important. Some doctors might not be as up to date on CMV as others and might have to look some things up, but that's okay. I think just still ask if you have those questions. So yeah, Amanda, I love that. Thank you so much for joining me today. This was fun.
Yeah, it was. I'm always want to talk CMV with people. I want everyone to know about this. So always willing to hop on a call and chat about CMV.
Awesome. And thank you to our listeners as well.